I'm Barney Hawthorne. I'm a consultant gastroenterologist working in Cardiff in Wales, and I'm the chairman of the IBD section committee of the BSG. I think the IBD Registry is a wonderful opportunity for us to do something which is world leading. The IBD community in the UK can engage in collecting real life data at a time when there are lots of changes happening in management of patients. The IBD Registry will give us the opportunity to collect practical data about outcomes, to measure what's happening. And so in the BSG, we are fully committed to getting as many people involved across the UK so that the data we collect is going to be really representative of what's happening across a huge population. We think that in this way we can be world leading in collecting real life data about our patients. And if we can use the registry to do this at the point of care, it's going to become part of day-to-day clinical practice. I think the IBD registry can improve patient care in a number of ways. So a good example is that it enables teams to have better management of patients. For instance, there's a desktop provision of information with key patient factors, for instance, the location of the disease, what investigations have been done, and what treatments they've had in the past and are on currently. And that can be printed off and given to the patient as a clinical summary when they're in the clinic. So that's very useful. Another example perhaps would be to use it to monitor patients on biologics or on azathioprine and to collect data on outcomes and on complications. With wide usage across the UK, we're going to have lots and lots of information from individual hospitals that can be used to benchmark against national level data, and that's going to be really important. This is an incredibly important time because of the explosion in availability of new drugs. There are novel biologics coming on stream, and we can look at the use of these new drugs or changes in clinical behaviour, for instance, earlier use of biologics, and we can collect real-life data about what impact that has on outcomes, number of operations, mortality, and complications. And it will enable us to do that, really, as part of day-to-day practice. Local hospitals will have to decide how they're going to engage with the registry. But one example would be for each member of the team to put data in on one or two patients in every clinic. And if that's done over a period of a year, then there'll be a large amount of data that can be used for quality assurance, for audit purposes, for costing, and lots of other ways, and will be incredibly valuable both nationally but also to the local team as part of their clinical activity. So when you open the registry web tool as part of a consultation, there'll be a lot of information there which will make a big difference to you. Much better than having to scrabble through a set of case notes. The registry is a really good opportunity for us, the IBD community in the UK, to be involved with something which is going to be incredibly valuable in terms of national level data about real life practice. Once you start entering data on individual patients, you're going to be immediately able to see summary data about patients, which is going to make it easier to manage those patients on a day-to-day basis. I think it's an opportunity that I wouldn't wish any of you to miss.